Hello there. Welcome to my show, COVID-19 update by Heerak. It's October 28th, 2020. Today is 19th Annual International Animation Day, October 28th, 2020. Your grandparents grew up loving Tom and Jerry show. Mickey Mouse is timeless. Mickey Mouse yesterday, Mickey Mouse today, Mickey Mouse forever. Parents love taking children to Disneyland and Disney World. Unfortunately, right now, because of COVID-19, any flying will endanger your children from getting COVID-19. So, here at Christian Kim, independent candidate for U.S. Congress of Virginia's 8th District, that's who I am, advise that you do not fly with your children to protect your children from COVID-19 death. No flying for children. During 6 months of flu season that is coming, a lot of children will die from COVID-19. Unfortunately, children die from flu and cold, common cold. In fact, children are the most vulnerable population for death from cold or flu uh, and elderly. So children and elderly are the most dangerous population for death during flu season. That's why healthcare professionals advise that all children and elderly get flu shots because children have the highest chance of dying in the flu season. So you should expect a lot of children to die in COVID-19 America. As you can see, I dressed up like Spider-Man. And Spider-Man, friend of children, right? But yeah, I love Halloween because you can dress up like your favorite cartoon animation character, like Spider-Man. I dressed up as a Spider-Man to the 2018 Halloween party thrown by Meredith Goodrich in my program, Clinical Nurse Leader at Georgetown University, CNL 2020. I belong to cohort 2020. We all graduated, 25 of us in August 24, 2020. CNL 2020, yay! Unfortunately, 5 of us are going to die from COVID-19 before Christmas 2020. Now, about 20% of us, that's my prediction. Based on facts and figures, obviously, a lot of people are dying from COVID-19 and we're just entering the flu season. And in the flu season, you can have, more than 50, you know, more than 50 states have multiple deaths. Yeah, it's just, that's what, flu season is, 50 states can have a tremendous number of deaths, all 50 states, because, people move around and that kind of carries the flu to all 50 states, even the states that are not necessarily in the area for flu, but with movement, flu is spread everywhere. And so we have a flu season for all 50 states. And COVID-19 obviously spread like wildfire in the summer in Florida, Texas, and California, the hottest states in America. So, you can expect a lot of people to die in these states as well in the flu season. Yeah, so yeah, it's a serious problem going into the flu season, 6 months of it. So that's like October, November, December, January, February, March. I guess it's a little longer than 6 months. April, May, all the way up to June. You can see flu. But generally, like by May, will have a tapering off of, flu. But, April, you saw how many people died in April in New York, right? 30,000-ish died in New York in April, 1 month. And look at 6 months of that, because most states missed the flu season, but it's different this time around. Every state is going into 6 months of flu season with COVID-19 proliferating everywhere. So you should expect a lot of deaths and, a lot of children are going to die. That's the unfortunate thing about that, because children are the most vulnerable from flu. And since April, when New York virus. That's the term that I gave to COVID-19 strain that mutated to infect children in large numbers and kill children. So because of New York virus, a lot of children are going to die in every state. I'm predicting minimum thousands will die in every state, maybe tens of thousands in some states. It could be more in some other states, but minimum thousands of children die in every state. So I would say that's guaranteed in the next 6 months of flu season because we know what the New York virus does. We have seen children get infected. And obviously, I'm just talking about COVID-19. There's going to be children dying from common cold, strep throat, flu, all kinds of RSV virus, all kind of viruses. Because in the time of COVID-19, healthcare provision is difficult for the most vulnerable population, like children and elderly. So the most vulnerable, like children and elderly, are going to die in large numbers. Because the reason that children don't die in large numbers in times when there's no pandemic, global pandemic like COVID-19, is that they could go to the hospital and get treated right away. That saves them from death. But that's not possible in the flu season that's coming for 6 months: October, November, December, January, February, March, April, maybe even Mayish. So your children are going to head toward death. A lot of your children are going to die just because they cannot get the treatment that they need in time. So had there not been COVID-19, they would not have died. But we don't live in a bubble. We don't live in Disneyland. There is COVID-19 everywhere. There is COVID-19 all over the hospitals. And hospitals are going to be packed with COVID-19 patients in November. Every hospital in this area, I'm predicting, will be packed with patients, and there will be no bed left in November. That's what I'm predicting for Virginia Hospital Center, where I work as a nurse, RN nurse, registered nurse. Fairfax Hospital, where I worked as a student nurse. Alexandria Hospital, which is really close from here. MedStar Georgetown Hospital, where I worked as a student nurse. George Washington University Hospital, where I worked as a student nurse. Children's National Hospital, where I worked as a student nurse. Sibley Hospital, which is quite close from here in Washington, D.C., Suburban Hospital in Maryland, and all the hospitals in Maryland and Virginia near D.C. area, you're going to be packed with COVID-19 patients. Hospital will not have any beds in November. I think that's rational to predict given the trajectory of COVID-19 right now and the fact that Washington, D.C. is a COVID-19 hotspot. And I'm predicting 1 million people in DMV zone. DMV zone is the greater Washington, D.C. area. DMV, D.C., Maryland, Virginia will have 1 million people die. I think that's being reasonable, given the fact that there's a lot of movement in this area. There are over 100 embassies. I don't think any healthcare expert doubts that 1 million people in DMV zone can die from COVID-19 in the next 6 months: October, November, December, January, February, March, April, May. It's more than 6 months, but next 6 months of flu season, nobody is doubting that that's possible. Nobody, no scientist, no nurse, none of the 4 million nurses in America doubt that the 4 million nurses, none of them doubt that 1 million people can die in Washington, D.C. area. You can ask any nurse in this area, they understand the possibility that can happen. Yeah. So maybe you want to say, I want to live in the manga world. Manga is like our generation, current generation's favorite art. But Tom and Jerry's, cartoons have been forever. So if you go to caveman sites, you have cartoon doodlings, right? It's been around since the caveman. As you know, I love children. I have taught fifth graders in Savoy Elementary School, which is in Anacostia neighborhood of Washington, D.C., which is Ward 8. I am a teacher, a fully licensed teacher in District of Columbia Public Schools. So before I started my full-time 2-year-long clinical nurse leader program at Georgetown University in 2018, which ended in 2020, August 20. Well, we graduated in August 24, 2020. No, August 24, 2020. So cohort 2020. CNL 2020, yay! Uh, I worked as a fifth grade elementary school teacher full time in Washington, D.C. So, there were two teachers in fifth grade. That was me, and there's another teacher. And we're a good team. We worked together. We had a lot of fun trips with our kids, fifth grade kids. Yeah, I had a lot of fun with my kids. School is 100% African American. The neighborhood is a very African American neighborhood, kind of like Newark, New Jersey, or there are cities that are very African American. Petersburg, Virginia, where I also taught eighth graders at Peabody Middle School, which is St. John's Middle School right now in Petersburg Middle School. Hey, my students that I taught there are still there. So, I'll see them, someday, people go to school and then they stay in the neighborhoods, It's like most normal people in America, it's not like they leave. Um, yeah. So, yeah. So, I try to do what I can for children. And I participate in Children's National Hospital fundraiser. Children's National Hospital is the children's hospital in Washington, D.C. And we have a fundraising event, and it's nationwide. Every children's hospital in the nation, United States of America, is, well, not every single one, but most of them are tapped into the Miracle Network, Children's Miracle Network hospitals. And in every city, there is this Miracle Network Dance Marathon, which is linked to Children's Miracle Network hospitals that, like children's hospitals in every city is linked to, and not just in the cities, but, children's hospitals are linked to. And we have a dance-a-thon, and each school has a chapter, so I belong to the chapter at Georgetown University, and so we have Hoyathon. So they raise funding through dance-a-thon. It's like a all-day dance-a-thon, and so I was involved in the Children's Miracle Network Hospitals Miracle Network Dance Marathon at George Washington, Georgetown University Hospital. One of our leaders transferred from George Washington University Hospital and became a leader of Georgetown University Hospital, Georgetown University Dance-a-thon. But she was involved with Dance-a-thon at George Washington University when she was a student there before transferring to Georgetown. Like some students transfer, like Donald Trump transferred from Fordham University, which is a Jesuit university in New York, and he transferred to University of Pennsylvania, which is an Ivy League university in Philadelphia, where I got my bachelor's. Yeah, so I've been working as a vice president of Penn Club of DC, which provides programs and network and support for University of Pennsylvania alumni. I'm sure there are a lot of University of Pennsylvania alumni at Virginia Hospital Center, among the nurses, doctors, executives. University of Pennsylvania produces a lot of executives. So a lot of CEOs, CFOs, COOs, the C-suite people. In every hospital has like University of Pennsylvania alumni, wherever you go. And wherever I go, I could, I'm an alumni, and I always write to the top. So I'll probably become a board member with whichever city I am in, of Penn Club of wherever they are, Penn Club Houston, Penn Club LA, Penn Club San Francisco, Penn Club Chicago. Every major city is a Penn Club. And I always rise to the top, wherever I am. So, I've been interviewing high school students who applied to University of Pennsylvania for over 10 years. So I'll be doing that this year as well. Penn sent me an email saying, please interview for us. They sent out these emails to those who've interviewed last year, and so I almost set to interview like 28 people this year. It's volunteer. I don't get paid to interview people, but I do this, and obviously, you have to meet certain criteria to be able to interview for Penn, because it's, admissions, right? Your children's admissions hinges on that. Their whole future hinges on that, So so it's a serious stuff, and Penn treats it seriously. I've been doing it for over 10 years and I've been very good at it. So I'm one of the veterans, I'm not I'm not a rookie interviewer, you know. Anyway, yeah. So I was an executive board member of the 2019 Hoyathon, the dance-a-thon at Georgetown University to raise money for Children's National Hospital, which is part of the nationwide Children's Miracle Network hospitals. So, I'm in, elite of the elites among the Children's Miracle Network hospitals, Network Dance Marathon, as an executive board member by definition, right? So, I'm happy, to serve as a leader, to help, good cause to raise funding, money for Children's National Hospital. We raised like $60,000 plus, but, we pale in compared to University of Maryland Miracle Network Dance Marathon team. They raised $1 million. I kid you not, they raised $1 million in one year in dance marathon for Children's National Hospital. $1 million. And you see, I spent some time to get to know the fellow executive members of the Miracle Network Children Marathon Dance Marathon. I'm very good at networking. I, people like me, people love me. People always want to like spend time with me. So, it's everywhere. It's not just with Pen Club of DC. Everybody who comes to events want to spend time with me because they love me. I'm like a little guy, I've actually met several, important surgeons, serious surgeons in hospitals. There are a lot of University of Pennsylvania alumni because, they have a medical school and nursing school, and they produce a lot of leaders. So every hospital has Penn alumni. So, I got to meet some important nurse leaders in this area, and doctor leaders in this area in my capacity as a leader of a Penn Club of DC, Penn alumni. Yeah, it's always good to see people. What can I say? Being popular is fun. But anyway, yeah. So I got I hooked up with University of Maryland leaders. They're all undergraduates. Even Georgetown University, all the leaders were undergraduates except for me. They made an exception in the history of Georgetown Dance a Marathon to include a graduate student in the executive board. Yeah. I'm popular. What can I say? I'm popular. I'm like, I'm like timeless. I transcend all age groups. I'm like popular in all age groups. When I was teaching children at Savoy Elementary School, I was like the most popular person in the classroom. Like kids don't like teachers, like some kids. That's not me. Like all my kids love me. So like I'm like the most popular. I'm the teacher, but like everyone loves me, want to do things with me, So I'm timeless. My students love me, regardless of what age group I teach. I taught, middle school, high school age group too, college students. Oh yeah, wherever I go, when I teach college students, I have 3 hour when I was teaching at Brown University, college students, and these are like most of them are billionaires and millionaires from around the world, or movie stars or whatever, Harry Potter, that Hermione character went to Brown, right? So you have like these movie stars as well, and rich, largely elites of the elites in every field send their kids, try to send their kids. They don't get accepted, some of them, but my 3 hour office hour. The students were lined up in the hallway, like they were sitting down and eating their lunch, making sure they get me, get into my office hour. I'm that popular. It was like that at UCLA when I was teaching. 3 hours office hour, kids are lined up, eating their lunch, making sure they don't miss me. Geez, I'm like popular wherever I go. I'm like, I transcend geographical boundaries. I transcend ethnic boundaries. I transcend class boundaries, whether you're rich or poor. I transcend all kinds of boundaries. What can I say? I am the Leonardo da Vinci of 21st century. There's nobody like me in 500 years. Yeah, and that transcends in every area, not just in intellectual. Yeah, but let's go to today's figures. 700 people have died in the last 24 hours from COVID-19 in America. So it's serious. We're heading into flu season. as I said, by November, all the hospitals in this area will be packed. So it's serious that we have such high numbers of death every day. Um, we have 226,752 people who have died from COVID-19 in America. That's like 250,000 people. That's like from March to now, basically. As you know, I started my COVID-19 update by Heerak show on April 2nd. On April 2nd, we only had 7,000 people who died from COVID in America. 7,000 on April 2nd, 2020. So if you take out the 7,000 from April 2nd to now, you had like almost 220,000 people die, 250,000. Oh, it's serious stuff. Yeah, it's no joke. And we're like, this is like during summer, where like 1,000 people die. The height of the second peak. Second peak I've identified as June to August. At the height of second peak, 1,000 people, more than 1,000 people are dying per day. And it was summer. Who dies in the summer from an illness like, quote, respiratory illness? Who dies in the summer from respiratory illness? It's ridiculous, but it's the fact. I know some of you cannot handle the truth. As Jack Nicholson said, you cannot handle the truth. In Feel Good Man, the movie. If you haven't seen it, you should see it. It's a good movie. Yeah, you see all these University of Maryland people. Most of them are from Maryland, so you may know them, like even nurses at Virginia Hospital Center. It may be one of your kids, for all we know. Yeah, I mean, so most of them are from, Maryland. This is College Park. But some are like from Georgia. I met a really nice, executive board member from Georgia who was really nice. And some are from Virginia and DC. But most are, from Maryland, and there's a lot from like this area, like this DMV zone. Yeah, yeah. Hi, everyone. Yeah. Yeah. So Brazil is number one for COVID-19 cases in Latin America. We have a lot of Hispanics, in this area. In Arlington, we have 100 different nationalities represented, but the biggest minority is Hispanic, far more than African Americans, and far more than Asian Americans in Arlington County. And it's unfortunate because a lot of Latin Americans are dying in Latin America, which means we're gonna have a lot of people die in Arlington as well. They're the same ethnic group. They socialize similarly. They eat the same kind of food. You are what you eat. You know what I'm saying? I love Latino food. But you are what you eat, right? And so yeah, so a lot of Latinos are gonna die, unfortunately, from COVID-19 in Arlington County. I think you should expect that. And I'm sure Virginia Hospital Center will be packed with a lot of Hispanics from Arlington in November, from COVID-19. I think that's coming. And obviously in Fairfax County, you have the Innova Fairfax Hospital in Falls Church area, and it's going to be packed with Hispanics, with COVID-19. Innova Alexandria Hospital is going to be packed with Hispanics with COVID-19 in November. MedStar Georgetown Hospital in Washington, D.C., along with George Washington University Hospital, along with Washington Hospital Center, and Suburban Hospital. Oh, that's in Maryland, but Sibley Hospital in DC will be packed with Hispanics. Yeah, I think the greatest number of people who die are Hispanics, and I think that's what evidence-based research has shown from March to now. The large number of Hispanics have died. So, it is based on evidence-based research. So, like especially Hispanic-heavy cities like Miami, Houston, Los Angeles, you're going to see a lot of Hispanics die. Just fact of the matter. It's based on research as well by scientists, social scientists, anthropologists, sociologists. You can't avoid it, unfortunately. And facts and figures are linked. That's why I share the facts and figures with you. Brazil is number one for cases at 5,439,641 cases, but their death is rising at 3%, but it may rise much higher in the flu season. 157,946 have died so far. Argentina is coming from behind. That's where our Pope Francis is from. And, what are you doing wrong, Francis? Pope Francis, what are you doing wrong? Your native country was low in COVID-19 cases and that. Now it's like spiking like there's no tomorrow. You must have done something wrong to piss off God. But anyway, you reflect on that and you have to repent what you did wrong. But when leaders do wrong, according to the Old Testament, and as you know, I'm a certified expert of theology who belong to professional associations of theologians around the world and who present at academic conferences where professors at Harvard University, professors at Yale University, professors at Oxford University, professors at Heidelberg University in Germany, professors from Hebrew University of Jerusalem in Israel. These top theologians go. I'm there presenting paper. I'm like in the cream de la creme among theologians. So yeah, I'm a certified expert. What can I say? I'm the Leonardo da Vinci of 21st century. And I'm not talking about the manga world here. I'm talking about the world of theology, where all the clergy and theologians go once a year. I go there, I present my paper. They're like, oh, we're not worthy. We're not worthy. Okay, they don't do that, but you get my point. They do that like symbolically or, figuratively or without them knowing unconsciously. Anyway, yeah. So Argentina is second now for COVID-19 cases. 1,116,609 people have gotten COVID in Argentina. And at 3% death rate, 29,730 have died. But it came from behind because it wasn't in the top 5 for the longest time. And it just rushed to number 2 spot. Jeez. Number 3 is Colombia at 1,033,218 cases. At 3% death rate, 30,565 people have died. Oh, no. We have a lot of Colombians in this area, too. Oh, you should worry. You should worry. Yeah, you should worry. Mexicans, but you should not worry as much as Mexicans. Mexico has 1,268 cases, but they have 10% death rate. Oh my goodness, even in the summer, they have 10% death rate. Some say it's because of all the dope, like marijuana, methamphetamines, cocaine. It's produced there. So even people who are not doing cocaine or marijuana or methamphetamine, maybe they're working around cocaine, methamphetamine, and you're going to breathe in that stuff even if you don't actively do it yourself. That may be the reason why your respiratory system is compromised, especially for COVID-19, and that may explain why so many people are dying. And there may be people who are doing the dope themselves, or there could be secondhand, right? If your friends are doing marijuana and you're around them, you may breathe in that stuff, secondhand smoking. Yeah, it's like, if you go into one of those cafes in Amsterdam, you may not smoke that stuff, but it's like everywhere. So you just there to drink a cup of coffee, but you may do secondhand smoking there. You know what I'm saying? Yeah, so Mexico has a 10% death rate, 89,814 people have died so far. So if you're a Mexican, I would like really, 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 really worry. Yeah, 10% death rate in the summer. Who knows what's going to happen during the flu season? 20% death rate, perhaps. Peru, yeah, Peru isn't that big of a nation, but it's big when it comes to COVID-19. 892,497 people have been infected at 40% death rate, which is higher than Brazil, Argentina, and Colombia. 34,257 people have died. So obviously they have more death than Argentina and Colombia because death rate is high. So you got to try to control the death rate. United States have a 3% death rate so far, but in the winter, we could have 10% death rate, even 20% death rate, especially if nurses die off or are sick with COVID and they can't work as nurses. Our death rate could go to 20% for our country. I'm predicting that minimum 12 nurses will die in every hospital in this area. That's Virginia Hospital Center, Innova Fairfax, Innova Alexandria, MedStar Georgetown University Hospital, MedStar Washington Hospital Center, George Washington University Hospital, Sibley Hospital, Suburban Hospital, Children's National Hospital. All the hospitals in this area will have minimum 12 nurses die by Christmas 2020. So I would say start your Christmas decorations early because you may die before even like month of December. Yeah, you may not be there. You may be dead by Thanksgiving. So I would say start, Christmas decorations now in case you, as a nurse, die before Thanksgiving. I think if hospitals are filled in November, I don't think anybody doubts that nurses are going to die. Nurses are going to get COVID and die. So I don't think I'm saying anything that's like out of the normal or out of unimaginable. I think most nurses working in hospital now know that there's very high chance they're going to get COVID, and there's chance that they're going to die from that if they get COVID. You know what I'm saying? So it's not like you're not going to be talking to a nurse who doesn't think they're going to get COVID. Sometime the next 6 months, 6 months, 6 months, 6 months. No, 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 don't tap your TV. Nothing's broken. I just repeated that just for emphasis sake. That's October, November, December, January, February, March. Okay, more than 6 months. April, May. We're gonna have like people dying, exponentially dying. It will be growing for the next 6 months. It's not gonna be like, oh, no, it's gonna be growing. It's like a little spark that becomes a fire. It only takes a spark to get the fire going. Yeah, I purposely did I don't know, you call it atonal, just for effect's sake. I'm not like atonal. What's the term? Like tone deaf. I'm not tone deaf. I'll prove it to you. It only takes a spark to get a fire going. See, I got the right tone. But, sometimes you have to miss the tone for emphasis, for emphasis, just to remind you what's coming. COVID-19 death. COVID-19 death is coming. Yeah. Yeah, it's just a fact. What can you do? So Peru has 892,497 infections. But at 4% death, as I've said before, I'm just going to repeat it for emphasis, more death than Argentina and Colombia, which have more cases. So Peru has 34,257. More people are going to die. Yeah, that's coming. What can you say? U.S. is headed to massive death. Signs and symptoms are there. We have 6 more months to go. That's 6 more months of infections. More importantly, that's 6 more months of death. Death. COVID-19 death, to be specific. Yeah, so the title for today is USA cities start to lock down for 6 months of flu season. Well, they have to. They have no choice. If you don't lock down, you die. Even if you lock down, you die. I mean, New York City was locked down in April, but 30,000 died. As I said, as of April 7th, basically the end of the flu season is around April, right? Or May. I mean, mostly April 7th. It's like flu season basically is like on the tail end of it. Only 7,000 people have died. All the death we have is after the flu season. It's not going to be like that this year. That's why I'm saying minimum 3 million, not thousand, minimum 3 million Americans are going to die in the next 6 months, because we are going to have full 6 months of flu season for everybody to die in. That's why. Yeah. I feel like I'm getting further away. That's because I am. But anyway, yeah. So so the first article is coronavirus news. COVID spike brings back lockdown style rules in Newark, New Jersey. Newark, New Jersey in the house. Yeah, so that's by staff in ABC 7 News, October 28, 2020. The tightest restrictions we've seen in months in the New York metropolitan area are now in effect in Newark, New Jersey. As we know, New Jersey was number 2 for COVID-19 death in April. I think they could expect to be number 2 in death again. You know what I'm saying? I mean, history always repeats itself. Hi, Governor Phil Murphy of New Jersey. Welcome to COVID-19 hell in New Jersey. That's because COVID-19 cases are spiking as they haven't since last spring, with most people hospitalized. Mayor Rasparaka, the principal at Peabody Middle School, we had like 3 principals in 1 year. Welcome to inner city school. But one of our three principals in that given academic year. His name was Baraka. Baraka. Maybe he's related. I wonder. But anyway, yeah, Mayor Ras Baraka reports the number of positive coronavirus tests has shot up above 25% in the city's east ward. 25% of the people tested got COVID. I mean, you kind of surprised. You should be surprised. It can happen in every city. I'm thinking that it will happen in Arlington County soon. Yeah. It will happen like, before you know it, like thief in the night. You have like 25% of everyone tested are infected. Like thief in the night. And you were like, this thing is good. Canada Dry. I highly recommend it. Canada Dry, cranberry. I got the diet version, no need for extra sugar, man. Yeah, so 25% of all those who are tested are getting infected, are found to be infected. Yeah, that's coming to Arlington County. Welcome to Arlington. Welcome to Arlington. Yeah, so citywide, the total is over 11% in Newark compared to a statewide rate of about 4.5%. So New Jersey has 4.5% so far. It's rising and rising. I mean, the whole state, who knows what's going to happen? We have 6 more months of flu season to go. It is possible for the state to have 25% infection among all those tested. It's possible. Everything is possible. Yeah, this is the first time we're going through a full flu season with COVID. Anything is possible. Nobody knows what's going to happen. Anything is possible. Okay, Sarah, what will be, obviously don't take that attitude because you can't prevent yourself and your children from dying from COVID in the next 6 months. Just watch this show every day, take the advice, do what I advised you to do, and you have higher chance of surviving. Second article, curfew is the new lockdown. Curfew is the new lockdown. Yeah, that's the song that everybody's singing from Europe to here. Some U.S. cities shut down at night. So it's just like shutting down just at night. To control COVID-19 surges. This article is by Susan Rowan Keller in Forbes. And the important blurb from the article is, first Chicago, now El Paso and Newark, as COVID-19 rampages across the country at a record-setting pace. Some American cities are taking a page from Europe's playbook and issuing curfews to bring surging COVID-19 infection rates down. But they're not coming down, folks. They're not coming down. We have 6 more months of COVID-19 surges to go. 6 more months. That's October, November, December, January, February, and then you have March, April, May, June. Yeah, a little more than 6 months, but you get the point. Yeah. Chicago bars and restaurants were first to shut down 2 hours before midnight on Friday night as a 2-week nighttime business curfew went into effect. It's starting. You know as well as I do, eventually the whole city will have to shut down 24 hours a day. That's coming. I mean, geez, anybody out there think that's not coming? Raise your hand. Raise your hand, anybody who doesn't think that's not coming. The 24 hours a day curfew. We have 6 more months to go. Raise your hand if you think that's not coming. A 24-hour day curfew, 7 days a week. Everything closed. Do you remember that? It's going to be worse this time because we have 6 more months to go. Yeah. With COVID-19 cases in the Windy City more than doubling over the past few weeks, Mayor Lori Lightfoot ordered non-essential businesses to close between 10 p.m. and 6 a.m. in an effort to bring infection rates down. You should expect to get fired from your job. Just saying, just saying. When everything closes, what do you think that means? You think they'll pay you when everything is closed? No, expect to get fired. Yeah, that's happening in the next 6 months. Um, Essential businesses like grocery stores, pharmacies, and restaurants will take out delivery services are exempt from the curfew so far. But let's see what happens. If you want to get a surgery, like your back is bothering you, your leg is bothering you, your arm is bothering you, or you need a surgery in your heart to fix a heart valve, you better get that now when you have the time, because for the next 6 months, COVID-19 is only going to get worse, right? Better find the hospital. If your hospital says, "Oh, come back in March," I mean, you may be dead from COVID by March because you cannot walk fast enough. Because you're in a room and you're limping because you didn't get that elective surgery. By the time you get out of the room, it's been like 10 minutes in the room. You know what I'm saying? Yeah, so you want to get the surgeries that you need that will enhance your body parts. Whether it's your hand, your feet, your back, your neck, your heart, for internal body organs. Like heart valve doesn't work. What if you get a stroke from that? What if you get a heart attack? In COVID-19 America, you may die because there won't be like beds in ICU hospital rooms for you. Just do the procedure now to avoid stroke or heart attack from a heart valve that's not working correctly. I mean, maybe your doctor identified it 2 years ago. Maybe he identified it like a week ago. You just have to get that done as soon as possible. If your hospital won't do it, find a hospital somewhere in the area that's respectable that will do it. Yeah, I mean, you got to be proactive about your surgeries. Yeah. So essential business like grocery stores, pharmacies, and restaurants will take out with takeout delivery service exempt from the curfew. Maybe they will still stay open, in the next 6 months because people need to eat. So grocery stores have to be around. Pharmacies, you need the drugs, right? So they have to open. Restaurants, like takeout food, like half the country can't cook. There's so much microwaving you can do. So yeah, they'll probably have to stay open through the curfew. Delivery services. A lot of people who are delivering food probably will get sick with COVID though. The height of flu season. Yeah, just saying. Third article. El Paso imposes curfew as virus cases overwhelm hospitals. We are in a crisis stage. That's going to be like every hospital, every city in the United States in the next few weeks. Yeah, you think it won't come? Oh, you're so naive. What can I say? You think everything's going to be okay? You're so naive. I mean, geez, that's what people were saying like in February. It's just going to go away. And you believe that stuff? Oh my gosh, this is global pandemic, COVID-19. It's not going to go away. You're not going to be okay. You're going to be suffering from COVID. And if you don't hide out from COVID, COVID's going to get you. And you're going to die from it. You better stop spending that money because you may need that money to go long distances after you're unemployed from COVID-19. Yeah, keep saving, dude. Keep saving. Don't be buying that, junk food. Yeah, keep saving. Yeah, so the third article is Paso imposes curfew as virus cases overwhelm hospitals. We are in a crisis stage. As I said, every city will be in a crisis stage. Every hospital will be in a crisis stage, like in November. That's coming in a few weeks. Few weeks. Can I get a 5 on a few weeks? Can I get a 5 on weeks? Weeks? At least it's not a few days, right? A few weeks. Yeah. It's by staff and CBS News. So the quote is residents in the Texas border city of El Paso have been urged to stay home for 2 weeks. Just stay home, dude. Stay home. That's how you live. For 2 weeks as a spike in coronavirus cases overwhelm hospitals. Overwhelm hospitals. Did you hear that? Overwhelm hospitals. As I said, every hospital in this area, DMV, so will be overwhelmed. Virginia Hospital Center will be overwhelmed. The University of Fairfax Hospital will be well overwhelmed. University Alexandria Hospital will be overwhelmed. MedStar Georgetown University Hospital will be overwhelmed. George Washington University Hospital will be overwhelmed. Children's National Hospital will be overwhelmed. Suburban Hospital will be overwhelmed. Sibley Hospital will be overwhelmed. MedStar Hospital Center, Washington Hospital Center will be overwhelmed. Yeah, every hospital will be overwhelmed in November. Yeah. The crisis prompted the state The crisis prompted the state to dedicate part of the city's civic center as a makeshift care center for the ill. El Paso County Judge Ricardo Samiego on Sunday night issued a stay-at-home order with a daily curfew. It's coming. Day curfews are coming. Day curfews are coming. It's coming. It's a wise decision. I applaud El Paso County Judge Ricardo Samiego because he is saving his people's lives. Yeah, a good leader saves his people's lives, right? And El Paso County Judge Ricardo Samiego is a good leader. Because a good leader sets out to save his people's lives, right? That's what Moses tried to do, in the Bible. Yeah. And so, yeah. What can we say? It's COVID-19 America. Good leaders will have to shut down to save their people's lives. That's just, there's no other way. What? You're not God. You're not immune to COVID-19. You're not immune to illness and death. You will have to shut down to survive COVID-19. There's no other way. What do you think? You're gonna mingle and socialize with COVID-19? No. Hopefully we'll have more good leaders like El Paso County Judge Ricardo Samiego, who cares about his people so that they don't die. You need to shut down Mayor de Blasio. You need to shut your city down. You need to shut your state down, Governor Cuomo. You need to shut your state down. Governor Gavin Newsom in California. Geez, shut your state down. I mean, how many people from your state do you want to die? Yeah, it's serious stuff. All these Democratic governors, they don't want to shut down. They don't want to protect their residents' lives. I mean, why do we have so many people dying in California every day? Because Democratic Governor Newsom doesn't care about whether his voters live or die. Yeah, people are thinking oh, they just want to vote, so let them vote. If they want to smoke, let them smoke. Yeah, if they want to risk their lives, just let them risk their lives. Let them have fun. I mean, everybody is free to do what they want. But on the other hand, there has to be some kind of social structures to protect citizens or residents of the state from death, right? Because not everybody's going to be an expert in everything, especially healthcare. That's why we have public health experts, public health policies to help people in times of crisis when they don't understand everything that's going on. As you know, I'm a certified clinical nurse leader, certified CNL. So I have a national certification, clinical nurse leader, CNL. And it is my duty as an expert of healthcare, as a clinical nurse leader, to inform you of the dangers that exist, to inform you of what's going on, inform you of evidence-based research regarding COVID-19, so that you are aware, and that is my public health service to you as an expert of healthcare, as a certified national expert of clinical nurse leader. And it is within my scope of practice to research evidence-based nursing, evidence-based healthcare, evidence-based science, research materials, and then make it digestible for the common folk, for people in the street who may not be experts of healthcare, and provide information at the fifth grade level where that you can understand, so you understand what is going on, what kind of healthcare risks are out there, what kind of measures you can take to avoid these healthcare risks and potential death from COVID-19. So I'm meeting the need of healthcare, right? Not only in Arlington County, not only in city of Alexandria, not only in city of Fairfax, Falls Church, not only in county of Fairfax, but throughout the United States and throughout the world. I'm using my expertise to help you survive COVID-19. And that's why you should watch this show every day, because the liberal media lies to you. The liberal media said you will have a vaccine by October. Do you see a vaccine? Do you see a vaccine? Do you see a vaccine? That's what I'm saying. Liberal media lies to you. You can't believe CNN. You cannot believe CNN. They keep lying to you. They say you have a vaccine by October. Do you see a vaccine? Do you see a vaccine? That's what I'm saying. Yeah. Anyway, I will tell you the truth that you need to understand where you are in COVID-19 and how you can survive it. So tune in tomorrow. Tell everybody that you know to tune in tomorrow, so that they can survive COVID-19, and then the children will not die from COVID-19 in the next 6 months. I hope that you will be well and that your children will be well too. Bye. See you tomorrow.